Dear ladies and gentlemen, thank you very much for this opportunity of addressing your meeting. I'm very sorry I was not able to join you in person, but I'm very honored by the opportunity to inform you a little bit about the work that we have been doing in the Every Woman, Every Child Innovation Working Group and the potential partnership with the South-South Global Assets Technology Exchange, SS-GATE. I wanted to give you a brief background on our project before I address the potential cooperation a bit more in detail. The Innovation Working Group is part of the UN Secretary General's Global Strategy for Maternal and Child Health, or Women's and Children's Health, which was launched in 2010 to accelerate the achievements on Millennium Development Goals 4 and 5. And at the launch, more than $40 billion were committed to addressing the needs of women and children in the developing countries. This initiative is very much an ongoing one, now under the umbrella of the Every Woman, Every Child initiative, where there's still great activity with the Family Planning Summit of last year, the Child Survival Call to Action, the recently launched Commission on Life-Saving Commodities recommendations. And under this Every Woman, Every Child initiative, there has been in work an innovation working group co-chaired by Norway, represented by Dr. Tore Godal, Special Advisor to the Prime Minister, and Johnson & Johnson, represented by their Global Head for Global Health, Dr. Scott Ratzan. And I've had the honor of being project manager for this innovation working group. And the working group has had a number of priority areas, particularly in the field of using mobile technology in supporting both frontline health workers as well as women and their families directly. We've also looked at medical devices and now most recently life-saving commodities, how they can be leveraged for these areas. We also looked at areas like low-tech but potentially high impact of implementing the use of checklists in the delivery of maternal and child healthcare services. And not least, we've looked at the use of more private-public partnerships. And under that umbrella, I had the honor of co-chairing a specific task force together with Merck and Naveen Rao from Merck on sustainable business models. And in that work, we came across the great efforts being done by UNDP and PAHO, together with what's known as South-South GATE. Because in this report on sustainable business models, we had three areas of actionable recommendations. And one was on expansion of specific incentives on how new businesses can actually reach the poorest. The other area was enabling environment for healthy businesses. And the third, which I'd like to spend 2 minutes on, is identifying and supporting investment opportunities. We think there's a great opportunity of moving from traditional financing by the donor community to channeling new resources to spur entrepreneurial activity in this area. For example, through social venture capital funds, or by identifying and incubating, scaling up new ventures. And it was in this area that we initiated discussions with the South-South Global Assets and Technology Exchange platform. And we see, and have addressed in the report as part of the conclusion, that there's an opportunity in building together on the existing network that you have with both public and private organizations in the various countries in the Global South, together with the web-based tools that you have, and the well-aligned mandate that you have with the mandate of the Innovation Working Group, and that we can basically address both issues of matchmaking and brokering new transactions between private sector actors and public sector actors in the South to expand sustainable businesses in the maternal and child health area. And it is one of the recommendations of this report to continue the discussions we've initiated and hopefully identify some very specific actions that we can venture into together to further these goals and, at the end of the day, support the achievement of the Millennium Development Goals 4 and 5. So again, thank you very much for this opportunity and all the best for the rest of your conference.